Okay, so we are going to pick up where we left off and continue. We're going to be looking at our white blood cell count and differential in this next component of our lecture. And white blood cell count and differential are a part of our complete blood count, and it is kind of the last component that we can order. Lots of different names can come up. Leukocyte count, neutrophil count, lymphocyte count, monocytes, eosinophils, and basophils. Some normal findings for total white blood cells include adult and child ranges of 5,000 to 10,000. Child under the age of 2 is a little bit of a higher reference range, and then newborns even higher and broader reference range, as we can see here. Our differential, we have two different values that you can see, percentage based and absolute. And we'll define here what that is, and we'll go back and look at them. So our absolute number of cell type is important for determining if a patient has sufficient number of cells of a specific type. For instance, how you calculate this is you take the absolute number would equal the total amount of white blood cells times the relative number of each cell type on the differential count, and you convert this relative percentage into a decimal space. So for example, an adult that has a total white blood cell count of 15,000 and a differential of neutrophils of 30%, well, that initially looks like neutropenia. Is it actually neutropenia? Well, we can calculate our absolute value. We can take 15,000 times zero point 0.3, and that gets us 4,500, which puts us in the normal reference range. So the patient has a normal absolute neutrophil count and only has relative neutropenia, not absolute neutropenia. When going back to the previous page, we can see, looking at our percentage breakdown, that we typically have the most neutrophils, then lymphocytes, and then we really have relatively small amount in proportion of monocytes, eosinophils, and basophils. And we'll remind ourselves here what those functionality of those cell types are shortly. Looking at our different types of white blood cells, the percentage, and then if we're thinking histologically, what is this description? Well, our neutrophils have many interconnected lobes and they have blue granules. Their job is to phagocytose and destroy bacteria as well as white blood cells. Our eosinophils have a bilobed nuclei. They also have red or yellow granules that have digestive enzymes, and they help with ending allergic reactions. And then our basophil have bilobed nuclei that are hidden, though, by large purple granules that are inflammatory in nature. They kind of have a similar function to mast cells, so they can degranulate and cause an inflammatory process. And our lymphocytes are dense, purple staining round nuclei and really don't have a lot of cytoplasm. And they're arguably the most important cells of our immune system and part of our adaptive immunity. And then monocytes are the largest of the leukocytes. They kind of have a kidney-shaped nucleus, and they can transform into macrophages in tissue and then become phagocytic. Looking at some critical findings here to keep in mind, white blood cells are too high if they're above 40,000 and they're too low if they're below 2,000. And some indications for a white blood cell count with diff would be if we're looking for infection, neoplasm, allergic response, or immunosuppression, then we would consider ordering this as a part of our CBC. Clinically, it's important to remember that a drastic decrease in white blood cells from maybe a patient's baseline could indicate a bone marrow failure, and that can be associated with increased risk of sepsis and death, so more of an urgent or emergent process. Serial white blood cell measurements can have a diagnostic or prognostic value. We can be tracking someone's response over time. And increased white blood cells can indicate infection, inflammation, tissue necrosis, or leukemic neoplasia, kind of in that order of operation typically. The procedure is the same as all of our others. You do not need to be fasting. Your blood tube type is a lavender tube. And some interfering factors to keep in mind, any stressor on the body, so eating, physical activity, and actually a mental emotional stress can increase white blood cell counts. Pregnancy and labor, specifically the last month of pregnancy, can increase, as well as a splenectomy. The values tend to be lower in the morning and higher in the afternoon or evening. And then there's lots of different medications and drugs that can affect either increase or decrease white blood cell counts. When we come back, we will look at different types of elevations and decreases in our uh, different types of blood cells, white blood cells specifically.